Welcome back, everyone. I'm Dr. Bobby. On behalf of New Age Cosmetic Wide EdTech Healthcare Consultancy, I welcome you back to my regular lectures. Today's subject is on childhood cancers, and we proceed with the topic of infection. So, proceeding with a saying of one among the patients, David was great about washing his hands. The nurse said this was the most important step he and our family could take to prevent infection. So, about infection and those affected by cancer, and during the course of treatment, infection happens when germs invade and grow in the body. Children being treated for earlier stages of cancer are often at increased risk of infection. Some cancers and some types of treatments make it harder for the body to make new white blood cells. Cells that help fight infections, often the main source of an infection in a child with a lower than normal level of white blood cells is from bacteria in his or her own body. Your child's nurse will check your child's blood cells counts. Lower blood cell counts or other signs of serious infection may delay treatment or mean that your child needs to stay in the hospital. In some cases, medicine may be given to increase the number of white blood cells after chemotherapy. And the side note on this in this context mentions of the following: wash your hands well. In order to get rid of infection, talk with your child's nurse to learn more about these and so other steps and your child can take. So, which means you have wash hands well. Always have your child and those around him, especially your family and the people on your child's healthcare team, wash their hands well with soap and water, warm water. This is especially important before eating, after using the bathroom, after being in a public place, and around pets if allowed. Stay extra clean. If your child has a catheter, it's important to keep the area around it clean and dry. It's almost important that your child's teeth are clean after meals and before going to bed. Check your child's mouth before sores or other signs of an infection each day. If a child gets a scrape or cut, make sure to clean it well right away. Stay away from germs. Your child needs to stay away from crowds and people who are sick. You may also need to take special precautions when preparing food. For example, fruits and vegetables may need to be cooked or peeled, and meats may need to be cooked thoroughly. Help your child eat with hot foods when they're hot and cold foods when they're cold. Don't let food sit out. Signs of infection. Infections during cancer treatment are medical emergencies. Discuss the signs of infection with your child's doctor and know what steps to take if your child has chills, cough or sore throat, ear pain, fever of 100.5 degree Fahrenheit or 38 degrees Celsius or higher, headache or sinus pain, neck that is stiff or sore, rash, sores or white coating in the mouth or on the tongue, swelling or redness, especially around a catheter, urine that is bloody or cloudy, pain or burning when urinating, other cells to call about. Right? Ask if you should take your child's temperature orally or rectally and check with the child's nurse to make sure you are taking the temperature correctly. Stress. Lowering stress can improve your child's mood and help reduce pain and discomfort. Tips to calm your child. Prepare your child. Work with your child's nurse and child life specialist to prepare your child for new treatments or tests. For example, children may visit this room where they will get treatment, touch the equipment, meet the doctors, and take part in medical play with a child life specialist or before a new test or treatment with a child life specialist or nurse before a new test or treatment. Help your child to relax Look for ways to help your child let go of stress and frustration. Ask about activities that can entertain and relax your child. Having things to look forward to, such as calls to friends, can also help. And be there for your child. Let children know you're there for them, and that they can come to you for a hug, laugh, an honest answer, or something for them, or for an answer or a shoulder to cry on. Get counseling support. A social worker, child life specialist, and/or nurse can help improve your child's ability to handle stress and difficult situations. For emotional problems that last or get more serious over time, your child's health care team can give you the names of psychologists or other mental health experts who can help. Visit practices that help children. Integrative medicine approaches section on page 76 to learn more about practices that may help or lower stress. When our son was stressed, sometimes a scooter ride down the hill helped. So this is about one among the patients and their effects, their responses. Other times we played cards or wrote together. Good way of downloading or downtrending their stress, right? I wouldn't say downloading stress. To mitigate their stress would be the right usage. Right, tips to help your child eat well. Talk with a registered dietitian. Meet regularly with a dietitian to get practical advice and strategies to help your child. Learn what types of foods and drinks are best for your child. Most children need to eat a variety of foods while focusing on nutrient-dense foods such as lean meats and poultry, whole grain breads, cereals and pasta, beans, rice, fruits, vegetables and dairy products. Ask your child's dietitian for recipes and easy snacks that are recommended for your child. Some children may be advised to get extra protein and calories. Foods high in protein help to build or repair muscles. Foods high in calories can prevent weight loss. These include foods such as eggs, cheese, whole milk, ice cream, nuts, peanut butter, meat, and fish. Encourage small, frequent meals. Smaller meals throughout the day may be easier for your child to eat than big meals. Check before giving vitamins or other supplements. Vitamin and herbal supplements may be discouraged because they can change how some cancer treatments work. For example, some vitamins interfere with the absorption of certain chemotherapy drugs. However, others may be safe, so it's important to talk with your child's doctor. Take special care with foods to lower the risk of infection. You may need to take special care as you handle and prepare foods. For example, fruits and vegetables may need to be cooked or peeled, and meats may need to be well cooked. Reduce side effects. Some side effects can make eating difficult. Here are tips to help manage side effects such as appetite loss, constipation, diarrhea, mouth sores, nausea, and vomiting. Call about changes. If your child is not eating well or drinking well, don't wait for your child to lose weight before taking action. About nutrition. Good nutrition can help your child to be better and stay stronger. Most often, good nutrition means eating a variety of foods. However, it's often difficult for children to eat well during treatment. And being upset or afraid may also make eating more difficult. At times, it may be hard to get your child to eat much at all. And some children need support, such as medicines to increase appetite, dietary supplements, and IV fluids. Your child will have a weight, height, and blood checked to assure proper growth and good nutrition. Keep in mind these suggestions. Be patient and praise your child when he eats well. It may take a lot of patience, creativity, and some trial and error to help your child eat well. Don't argue with, nag, or punish your child or make her eat. Keep meal times calm. Sometimes watching television or a movie can distract your child. and make it easier for him to eat. Physical activities such as walking or playing may increase your child's appetite. Ask you about activities that may be recommended to increase your child's appetite. In addition to drinking water, my child would drink a homemade smoothie made with fruit, milk, and peanut butter in the blender. On days when he didn't feel like eating too much, we focused on offering him healthy fluids. Tips to help your child drink liquids. Drinking enough liquid is extremely important. It's especially important if your child has less of an appetite, is vomiting, or has diarrhea. Losing fluid can lead to dehydration, a dangerous condition. If your child becomes weak, dizzy, and has dark yellow urine, he is likely dehydrated. Taking these steps to help your child drink enough liquids. Learn how much liquid your child needs each day. Talk with your child's dietitian or nurse to learn how much liquid your child should drink each day to prevent dehydration. This will help your child's age and other health conditions, such as if she is also losing fluids through vomiting or diarrhea. Give your child choices. In addition to drinking fluids, you can serve other liquids such as popsicles, jello, pudding, ice cream, and soup to help your child. Slow may be best. If your child has an upset stomach, try liquids first. Start with small amounts of clear liquids, water, Pediatric, broth, or jello. If your child can keep these down, you may want to try adding denser liquids such as strained cereal, pudding, yogurt, or milkshakes before slowly transitioning back to solid food. Try making shakes or smoothies. Some children find shakes or smoothies made from nutritious, high-calorie, high-protein foods are easier to get down than solid foods. It may also be more fun to drink through a straw. Talk with your child's dietitian about whether to add nutrition supplements. Pain. Seeing your child's condition in pain is extremely difficult. This section can help you learn how to work with your child's health care team to prevent or reduce pain that your child may have. Controlling pain is an important part of treating children with cancer. Pain is not something that your child has to put up with. Your child will feel stronger and better during treatment if he doesn't have pain. Pain can suppress the immune system, increase the time it takes the body to heal, interfere with sleep, and increase the chances of depression. What causes pain? These things may cause your child pain during treatment for cancer. Treatments such as surgery, procedures such as bone marrow aspiration or a spinal tap, needle sticks for blood draws or injections, side effects such as mouth sores, constipation or diarrhea, cancer, such as when the tumor presses against nerves or other parts of the body. How can I tell if my child is in pain? Trust your judgment and observations as a parent. If you think something isn't right and your child may be in pain, talk with your child's doctor. Signs of pain vary by age. Very young children, babies and young children show discomfort by crying when touched, or they may cry more often or have a different sounding cry. Other signs of pain include not being able to be comforted or being withdrawn or tense, a change in sleeping or eating patterns, or tugging at a part of the body may also be signs of pain in young children. Older children. Older children will usually tell you when something hurts. Still, some children do not want to let on that they are in pain because they do not want to upset you. Older children who have pain may wince, moan, or grimace. Their eyes may be red or puffy from crying. Encourage your child to tell you or the doctor about pain. Who treats pain? Experts. Pain experts may be oncologists, anesthesiologists, neurologists, surgeons, or other doctors, such as psychiatrists, psychologists, nurses, or pharmacists. Specialists in music or art therapy, or those who practice acupuncture, biofeedback, massage therapy, or hypnosis may also help to reduce pain. These specialists often work together as part of a pain or palliative care team to assess your child's pain and develop a pain control plan. How is pain controlled? Each child needs a personalized plan to control pain. Based on the age, treatment, and side effects, you and your child's healthcare team will work together to manage your child's pain. Over-the-counter pain medicines such as ibuprofen, also known as Advil, or acetaminophen, also known as Tylenol, may reduce pain, and a good first approach. Opioids may all be prescribed if the over-the-counter medicines do not work. Talk with your child's doctor or nurse if you have concerns about the possibility of addiction to pain medicine. Not giving a child enough pain medicine can lead to pain that could have been prevented. Excuse me. In addition to medicines, certain practices can be used to lower pain. Distraction and relaxation, playing games, listening to or reading books, or watching movies may distract or take your child's focus away from the pain. Activities such as playing music, breathing exercises, or blowing bubbles may help to relax your child, which can lower pain, stress, and muscle tension. Complementary practices such as massage or acupuncture. These practices may be effective in lowering pain. Heat and cold therapy. A heating pad may relax to help reduce pain. Cold packs may help reduce swelling and pain. Exercise. Walking and other gentle exercises increase blood flow and raise endorphin, substances that body makes naturally to reduce pain and give a feeling of well-being. Sleep. Being well rested may reduce children's level of pain and improve their overall sense of well-being. Learn about more ways to reduce pain in the practices that help children. Integrative medicine approaches section on page 76. What steps can I take at home or help to reduce pain? Here are some ways you can help reduce pain levels when your child is at home. Follow all instructions from your child's doctor. You may be asked to take your child's temperature and check with the doctor before giving some pain medicines. This is because some pain medicines can reduce fevers, which may mask or hide this sign of infection. Give the pain medicine as prescribed. Make sure your child takes the correct amount of pain medicine at the right time. Don't try to hold off or wait until your child's pain gets too bad before giving pain medicine. Waiting too long between those doses could make the pain take longer to go away or increase the amount of pain medicine needed to lower pain. Learn what side effects to expect from pain medicine. Pain medicine may cause sleepiness, stomach upset, constipation, or gas. These side effects may lessen over time, but your child's healthcare team should always be told about them. Use a pain scale. Ask for a pain scale from your child's hospital that is age appropriate. Ask your child questions such as where does it hurt? What does the pain feel like? How bad is the pain? When did the pain start? Track your child's level of pain. Keep a written record of pain can help your child's health care team to develop a pain control plan for your child. Take it with you to appointments. Keep a chart or take notes and write down information such as the date and time your child had pain, your child's pain level when medicine was given, the type and amount of pain medicines given, what time it was when the pain went away or when the pain medicine was given, again, side effects or other problems from the pain medicine. As said by another patient, we use a chart at home to record Jesse's pain level and then shared with his doctors. We found that the pain medicine worked well to keep his pain under control. Acupuncture also helped. Sometimes we watch movies which help to distract him from the discomfort. What should I call my doctors about? What should I call my child's doctors about? Contact your child's doctor right away if the pain is severe and you are not able to reduce it. Uncontrolled pain is a medical emergency. Call your child's doctor if the pain isn't getting better or going away with the pain medicine. The pain makes it hard for your child to eat, sleep, or play. Your child has new pain. Another comment. A child's doctor helped us control our son's pain. She was so kind. She also explained that my child wouldn't get addicted to pain medicine that was taken as prescribed. This helped me to understand that I should not try to hold off or limit his pain medicine. Immunizations. That's another comment again. We talked with Jasmine's nurse to learn what vaccine she and her sisters could get when she was going through treatment and which ones we needed to delay. During treatment, always check with your child's doctor before getting or refusing a vaccine. Your child should not get a live vaccine or have close contact with someone who has recently had such a vaccine. Measles, mumps, chickenpox, as well as flu mist are all examples of live virus vaccines. A child may be able to receive a flu shot, which is an inactive virus vaccine, as well as vaccines that do not contain live viruses or bacteria, such as those against diphtheria, whooping cough, pertussis, and tetanus. After treatment, your child's doctor will advise you when it is safe to receive a live vaccine based on your child's situation. Related resources, side effects, eating hints, pain control, support for people with cancer. Finding ways to cope and stay strong. Here's another comment. Being strong meant learning to rely on others. I found that friends wanted to be there for our family. All I need to do was ask. I also met with a counselor who gave me insights and listened in ways that friends could not. Asking for support from others may not be easy. So this section has practical advice to guide you to help you need during this difficult time. Stay emotionally and physically healthy. Staying emotionally and physically healthy can enable you to tackle the many tasks surrounding your child's treatment. Getting help and support from others. Research shows that you most likely already know help from others strengthens and encourages your child and family. Let others help during this difficult time. Family and friends may want to assist, but might not know what you need. You may want to 1. Take the first step. Let family, friends, and co-workers know about your child's cancer and treatment. Share only what you feel comfortable sharing. Tell people how they can help keep a list of things that others can do for you or for your family. For example, people can cook, clean, shop, or drive siblings to these activities. Find an easy way to update family and friends. You may want to use a social media site or a site such as KORAH pages, Caring Bridge, My Cancer Cycle, or mylifeline.org to update people and ask for practical help. Other sites such as Lotsa, Helping Hands, make it easier to organize help from people in your community. My neighbor Liz is a gem. She posted updates for our friends about Calvin's progress. She also helps friends make posters to decorate her son's room. Getting professional help. If you are not sleeping well, are often in a depressed mood, or feeling irritable or anxious, talk with your primary care doctor. Your doctor can give you the names of healthcare professionals who can help you, such as a psychiatrist, psychologist, family therapist, or social worker. Some parents find that it helps to talk with a leader in their spiritual community. Here's another comment. I'm not the kind of person who seeks outside help, but I was feeling so overwhelmed that I knew it was time to see a counselor to get my stress under control. Getting advice from a trained specialist really helped me get through this difficult time. Joining a support group. Some support groups meet in person, whereas others meet online. Many parents benefit from the experience and information shared in these groups. Some parents find online messages and message boards helpful. Another comment. My wife and I knew we couldn't tackle this alone. We met with a support group for parents or children with cancer. Our group brings in experts and we learn what has helped others. We're also able to post messages to an online support community that's been helpful. Working to keep relations strong. Relationships are often strained and under pressure. When a child has cancer, it may help too. Keep lines of communication open. Parents often have different coping strategies. Now, keep lines of communication open. Parents often have different coping strategies. Talk about how you each deal best with stress. Make time to connect even when time is limited. Remember that no two people cope the same way. So if your spouse or partner does not seem as distraught as you, it does not mean he or she is suffering from any less pain than you are. Remember that no two people cope the same way. If your spouse or partner does not seem as distraught as you, does not mean he or she is suffering from any less than you are. Make time for your loved ones. Even a quick call, text message, or handwritten note can go a long way in making a loved one's day a good one. Another comment. I knew we were in trouble even before the social worker told us how many marriages fail when a child is very sick. My husband and I deal with stress in every different way. It helped to try and understand where the other person was coming from. Did I read that right? Let me see. It helps to try and understand where the other person was coming from, yes. Making time to renew your mind and body. Another comment. I knew that in order to be there for my child and my family, I needed to reach a calm place within myself. So it can be tempting to put your own needs on hold and to focus solely on your child, but it is important to take time for yourself so you have the energy to care for your child. Here are some tips to get started. Just a second. Find ways to relax and lower stress. Some patients try something new, such as a yoga or deep breathing class at the hospital. Others are refreshed by being outdoors, even for short periods, whatever the method or place. Find one that feels peaceful to you. Eat well. Good nutrition will help you keep up your energy and stay healthy. Pack a healthy snack with some fresh fruit. Avoid eating fast food whenever possible. Get plenty of sleep. See a doctor if you have trouble sleeping or feel exhausted during the day. Stay active to sleep better and stay calm. Try to walk, jog, go to the gym, or follow an exercise DVD. If it's hard to stay physically active at the hospital, try walking up and down the stairs or around the hospital or unit. Fill waiting time. Pick a few activities that you enjoy and can do in your child's room, such as playing a game, reading a book or magazine, writing or listening to music. Get feelings out, write or draw, or choose another way to express your thoughts and feelings. Rely on your faith or belief system. Some people find that cancer brings a new or deeper meaning to their faith. Other feelings that their faith has let them down. Some parents pray, read their religious books, meditate or talk with spiritual leaders. Sometimes writing in a journal, reading, or simply being still can help. Related resources: coping with cancer, when someone you love is being treated for cancer, support for caregivers. Helping a child cope. Here's another comment. Our child met other cancer survivors who are leading amazing lives despite or perhaps because of all they have been through. It helps to see yourself as a hero. While treatment brings many changes to a child's life and outlook, changes to your child's daily routine, appearance, and friendships may be especially challenging to deal with. Not being able to go to school or do some other normal activities can make your child feel alone. Long hospital stays and time away from friends and family can also take their toll. You can help your child by letting her live as normal a life as possible, although many activities may seem to be changed. New activities and people can be added to their place. Talking with their families who are going through similar events can also be beneficial. Here are some ways to help your child learn what to expect. Ask how the type of treatment your child is receiving has affected other children so you can prepare your child. Be open and ready. Encourage, but don't push your child to share his feelings. Be there when your child comes to you. Check out activities at the hospital. Learn about events and programs at your child's hospital. Take care of yourself. Children sense when the parents are stressed. It helps them cope knowing that their parents and siblings are getting support. Changes in appearance. Another comment: offer a fun cap, a new outfit, or makeup can lift your child's spirits. It helps to feel good on the outside, even or perhaps especially when your child feels down and tired on the inside. Children can be sensitive about how they look and how others respond to them. Here are some ways to help your child. Right, prepare for hair loss. If treatment will cause your child's hair to fall out, let your child pick out a fun cap, scarf, and a wig ahead of time. Try to pick out a wig before the hair falls out so you can match it to their hair color. Sometimes cutting your child's hair short before treatment helps make hair loss a bit less upsetting. Be aware of weight changes. Some treatments may cause weight loss and others may cause weight gain. Get advice from a dietitian so you know what to expect and how you can help your child prepare for and cope with physical changes. Be creative. You and your child may shop for outfits that your child likes. Sometimes a cool t-shirt or fun hat helps to build self-esteem. Changes in friendships. Sometimes your child will make a new best friend. Sometimes friends your child thought would be there out for them are not. Other times you may experience the kindness of strangers. Excuse me. Your child's friendships are tested and may change during a long, serious illness. Sometimes it may seem as though your child's old friends are no longer there for them or that they don't care anymore. Your child's friends might not know what to say or they might be afraid of saying the wrong thing, so they say nothing at all. Unfortunately, some children speak before they think or before they have the facts. No matter the reason, it can hurt when classmates and friends seem uncaring. Sometimes it may seem as though your child's friends are moving on with their lives and your child is left out. It may help if your child takes the first step and reaches out to friends. The good news is that your child may make new friends through this experience. Going to support groups is one way to connect with others. Some groups meet in person and others meet online. Your child's social worker and child life specialist are also sources of support and guidance. For example, they can role-play conversation with your child that may be helpful. Here are some steps that you can take with your child. Help your child stay in touch with your friends. You can encourage and help your child to connect with friends through text, emails, online video chats, phone calls, and/or social media sites. Sometimes a social worker or child life specialist can help your child think through what they would like to share with friends. if possible, and when your child is up to it, friends may be able to visit. Help your child know how to respond. Sometimes people will stare, mistake your child's gender, or ask personal questions. Talk with your child and come up with an approach that works. Your child may choose to respond to or ignore commands. Here's another comment. At first, Meg's friends came around often, but as the school year went on, her friends got involved in their own activities and visited less. The girls were nice kids. They continued to call, but it got harder to have things in common. The longer Meg was out of school, Meg found she had more in common with new friends she met at the hospital. Right, the next will be changes in feelings. Try to stay upbeat is another comment, yet keep it real. Don't put on a mask or your child would put on one too. But put one on too, and by the way, it's okay to be silly too. Although over time many children cope well, it's common for your child to feel anxious, sad, stressed, scared, or become withdrawn from time to time. Talk with your child about what they are feeling and help them find ways to cope. You and your child can also meet with a social worker, child love specialist, or psychologist about feelings that don't have any solutions or seem to be getting worse over time. These specialists can help your child manage difficult feelings before they cause physical problems such as changes to sleeping or eating habits, anxiety, or depression. Reassure children that they can always come to you, listen, and be open to what your child has to say. Some children prefer to express their feelings through drawing, painting, writing, and playing music. Try these tips to help your child cope with different emotions. Find ways to distract or entertain your child. Playing video games or watching movies can help your child to relax. Practices such as muscle relaxation, guided imagery, and biofeedback may also help. See the practices that help children integrative medicine approaches section on page 76 to learn more. Stay calm. Your child can feel your emotions. If you often feel sad or anxious, talk with your child's health care team and your doctor about the best way to manage these emotions. However, if you often hide your feelings, your child may also hide their feelings from you. Get help if you see signs of depression in your child. It is normal for your child to feel down or sad sometimes, but if these feelings last for too long and happen on most days, they may be a sign of depression. Depression is a physical medical illness that can be treated. Child life specialists, social workers, counselors, psychologists, psychiatrists, and other specialists are all people who can give your child extra support during this difficult time. Signs of clinical depression include: if your child has any of these signs, talk with the doctor. No longer enjoying activities that your child used to enjoy. Changes in eating or sleeping habits, example, not sleeping well. Feeling or acting sad, nervous, sluggish, or tired. Feeling worthiness, feeling worthless or guilty even for things that are not one's fault. Having trouble paying attention, talking about death or suicide. Changes in schedule, hospital and school. Your child may spend more time at the hospital and less time at school during treatment. Here are some ways to help your child cope with long stays at the hospital and always from school. Hospital stays. Being in the hospital can be difficult for anyone, especially children. It is a different setting with new people and routines, strange machines, and sometimes painful procedures. Try these tips to make your child's time away from the home a bit easier. Bring in comfort items. Let your child choose favorite things from home, such as photos, games, and music. These items can comfort children and help them to relax. Visit game rooms or playrooms. Visit game rooms or playrooms. Many hospitals have the place where children can play, relax, and spend time with other children at the hospital. These rooms often have toys, games, crafts, music, and computers. Encourage your child to take part in social events and other activities that are offered at the hospital. Decorate your child's room. Ask if you can decorate your child's hospital room. Posters, pictures, and other decorations may brighten the room and help cheer up your child. Window markers are a fun way to decorate windows. Check to see what items can be brought into your child's room, since there are sometimes medical restrictions. Explore new activities. If sports are off limits, learn about other activities that can help your child stay active and have fun. Your child may also enjoy listening to music, reading, playing games, or writing. Some children with cancer find new skills and interests that they never knew they had. Missing school. Alright. Most children with cancer miss school during treatment. Some children are able to attend from time to time, whereas others need to take leave of absence. Here are some ways to get the academic support your child needs during treatment. Meet with your child's doctor. Find out from the doctor how treatment may affect your child's energy level and ability to do schoolwork. Get a letter from the doctor that describes your child's medical situation, limitations, and how much school your child is likely to miss. Learn about assistance from the hospital and your child's school. Some hospitals have education coordinators and others have nurses who will tell you about education-related resources and assistance. Ask about an individualized education plan, IEP, for your child. This is an education plan for children with certain health conditions or disabilities. It describes what special services are needed, such as special class placement, extra help with class assignments and tests, tutoring, and other services such as counseling, speech therapy, and physical therapy, and how these services will be provided to your child. Keep your child's teachers updated. Tell your child's teachers and principal about your child's medical situation. Share the letter from your child's doctor. Learn what schoolwork your child will miss and ways for your child to keep up as they are able. Talk with people at the school and hospital to make a plan that meets your child's educational needs both during and after treatment. Going back to school. It is best for most children with cancer to return to school as they are able. It helps to have a routine and to be with other children. Still, the adjustment may be challenging. Your child may have fallen behind and have low energy. Friendships may have changed. Children often feel self-conscious about changes in appearance and weight. Ways to help your child get back into a swing mode of things at school. Learn about back-to-school programs offered by many hospitals. These programs help classmates and teachers learn about cancer and make your child's return to school easier. Talk with your child's school so they can give your child any needed support. The teachers can also talk with your child's classmates and help them welcome your child back. School counselors and school nurses may also be a big help. Talk with parents and classmates. Let them know your child is coming back to school. Plan times for your child to get together with the classmates to catch up and play. Check out the in-depth information links on educational issues in school for children with cancer listed below. Another comment, Hong was eager to go back to school even during treatment, so we wrote up an emergency action plan and gave copies to his teachers and the school nurse. School Support COG, Educating the Child with Cancer, ACCO are all related resources. Helping brothers and sisters. There's another comment, when a child is diagnosed with cancer, everyone in the family needs healing, including siblings. That's super sibs. That's what it shows in parentheses. As a parent, you want to be there for all of your children. But this can be difficult when one of your child is being treated for cancer. You may notice that your other children are having a difficult time but not knowing what to do. Simply telling your children that you know how difficult it is for them and that you love them can be comforting. Even small amounts of time and attention can make a big difference in helping your other children. This section addresses the needs and feelings of siblings and suggestions that may help them. Although probably most siblings cope well, some do not. Be proactive and talk with a counselor at your child's school, your child's pediatrician or social worker at the hospital. They can give you advice and help you find local programs, support systems, counseling, and other services that help. At times I felt like the situation was harder on our daughter, Aaron's sibling, than it was on us. We struggled to have the energy In time for her, I felt guilty. I realized now that there was the book. Conversations we could have had and things we could have done that would have made a big difference in her life. A book made for siblings. This booklet can help siblings when their brother or sister has cancer, although designed for teens. It can also be used with younger children. In this guide, siblings can learn what has helped other siblings, get ideas about how to deal with changes in the life and the family, read tips about what to say when friends ask tough questions, learn about cancer and how it's treated. You can be parts of the guide online. You can also download or order free copies of this booklet. Now, how your children may feel. How well your children may feel. I think there's a discrepancy in the sentence. Right, it's about how children feel in this context. It's simple as that. We know that siblings of a child with cancer face many situations. Many are sad, scared, and confused. Although many try to be brave and helpful, they may feel left out and alone. Your child's siblings may feel scared about what might happen to their brother or sister, guilty about being healthy and having fun, sad for their brother or sister, worried that they will get cancer too, alone, neglected, ignored, and left out. Mad that this is happening to their family, sad for their brother to stay, worried that they will get cancer too, alone, neglected, ignored, and left out. And worried that they will get cancer too, alone, neglected, ignored, and left out. Lonely because they are seeing less of their parents and friends, embarrassed about the way people stare at or walk through about their siblings, jealous about the attention and gifts their brothers or sisters receive, concerned about what is happening to their family, and overwhelmed with all of the changes. In addition to these feelings, you may also notice changes in a sibling's behavior. Are you well? Children having trouble sleeping? Excuse me. Does your previously outgoing child now seem quiet and withdrawn? Have you noticed any changes in your child's grades at school? Does a formerly good student suddenly stop doing her homework, either to get your attention or because she's having trouble concentrating? Check in regularly and with your children to see how they are coping and talk about any changes you notice. Ask them what is most difficult about what is happening. Talk about ways you can work together to help each other. Seek help from a child's pediatrician for problems that last or get worse over time. Ways to help siblings. It's a comment there. Talk with the child's teachers. Get help from other adults you trust and respect. My neighbor is Christian and made sure homework got done and our kids got to the activities. These suggestions have helped other families. Listen to and talk with your other children. Set aside some time every day, even if it's just a few minutes to spend with your other children. Tell and show them that they are loved. Ask how they're feeling. Even if you do not have an easy solution, sometimes just listening is very important. Keep them informed and involved. Talk with your other children about their siblings' cancer and tell them as best as you can what to expect during treatment. Possible, find ways to include them in visits to the hospital. If you are from home, stay connected through emails, texts, and phone calls. Keep things as normal as you can. Arrange to keep your other children involved in school, related events, and other activities that are important to them. Seek out support from healthcare professionals. Be proactive and talk with your children's pediatrician as well as social worker at the hospital where your child is receiving cancer treatment. With suggestions for local prognosis programs, activities, and counseling services. Talk with friends, families, teachers, coaches, clergy, and others. Ask key people in your family's life to give siblings other extra support. Most people want help and will appreciate being asked. Keep in mind that some teens may not want people from outside the family to know what is going on at home. Talk with your children if you plan to reach out to others, such as the teachers or coaches, on their behalf. Some people can help. Siblings of a child with cancer may include. Some people who can help may include grandparents, aunts, uncles, cousins, friends and neighbors, patients, parents of your child's friends, teachers and coaches, people from your religious community, school nurses, guidance counselors at school. Another comment, Gail and Matt were able to relax and have a good time when they were camping with our neighbors. I think being out in nature, hiking, and relaxing for a weekend was just what they needed. Related resources on this would be When Your Brothers and Sisters Has Cancer, a guide for teens, When Your Brother or Sister Has Cancer, and others about depression, PDQ. That's an important topic. Getting organized. Right, that's another comment. The hospital kept records, and so do we. I use my phone and computer to keep track of medical tests and treatment details. I kept a file on my computer where I entered key medical information. Came in handy with all the different doctors my child saw. As challenging as it may seem, keeping a record of the medicines, tests, and treatments your child receives is extremely important. So too is organizing medical bills and insurance information. This section has tips to help you keep track of both medical and financial related information. Tracking key medical information. Keep track of the medical care your child receives. Some parents write important information in a notebook. Others prefer to organize this information on the computer or phone. You can also set up a personal health record, PHR, that allows you to enter, manage, and track your child's important medical information. A PHR is similar to an electronic medical record that your child's doctor or insurance company may keep, except that with a PHR, you are the one who keeps it, and controls access to it. Increasingly, healthcare providers, insurance companies, and employers are providing parents with access to electronic tools. Talk with your child's social worker or financial officer at the hospital to learn more about ways to track key medical information. What is important is not the exact tool you use, but that you keep medical information organized and accessible. Many parents also keep a journal and calendar too. For example, you may keep a journal where you write down details about side effects your child is having or questions to ask the doctor. Calendars can be used to track daily events and important dates to remember. You can learn more about these and other health tools, e-health tools, in the related resources section on page 65. Track medical care. On the next page is a chart of the type of information that's helpful to keep handy and up to date. Example, you should ask for and keep copies of scans, pathology reports, and treatment plans. Keep these in a file folder or scan them into images that you save on your computer. That's a comment now. I was overwhelmed with bills and paperwork, so I asked my brother for help. He was great at comparing itemized bills from the hospital with statements from the insurance company. He organized all the information and called the hospital insurance companies when things did not match up. This was one less thing I had to worry about. So this is a pro forma of the medical list: medical visits, type of visits, provider's name, reasons for visit, test procedures and lab-related lab reports such as CT scans, MRIs, blood counts, treatments, various treatments, names, amount of chemotherapy given, as well as doses, areas, treated with radiation therapy, and the list of medicines is separate, other supportive or complementary care received, right? In addition to tracking ongoing medical care, it is helpful to keep a sheet with this key information handy for yourself and others: names and contact information of people on your child's healthcare team, diagnosis information, treatment plan, life-threatening health issues for which urgent medical care should be sought. Track medical bills. It is important to understand your health insurance policy and to develop an organized way to pay and or follow up on bills. This means first reading and understanding what is in your health insurance policy. Call the insurance company and ask about Anything that you are unsure about may also help. Talk with benefits coordinator at your workplace or insurance company. Learn what tests and treatments are covered by policy and which, if any, are not covered. And the doctor requests a test or procedure that is not covered by insurance, ask the doctor to write a letter stating what is needed. Ask to have one case manager at the insurance company assigned to you, and develop a system to track medical bills, right? Organize these items by date, bills from the hospital, explanation of benefits, etc., and receipt for payments with tax deductible.